Hi guys, good morning if you are in Philippines and good evening if you are in United States of America. It's me again, Dr. Jenny Yusuf, physical therapist and Doctor of Physical Therapy, creator and founder of Balance and Fall Support Group in Aging Adults and Physiogen PT and Wellness. We are now again doing our Thanks God It's Thursday, and these are being featured for our innovators, entrepreneurs, physical therapists, and other educators and academicians. We are so fortunate enough for today to have the opportunity to interview Dr. Jeofrey Delacruz. He is known as Tom to his clients and patients. So today he will going to explain to us his passion and his expertise and share us what is man up. So man up, he is expert in martial arts. He is also orthopedic manual physical therapist. He is credentialed in that, and also in STEP. He is the first or pioneered in the scientific therapeutic exercise program in the residency in Seattle before. 20 plus years of great experience as a physical therapist. So he is more on expert in Parkinson's disease and in neurologic cases. So to share his skills to us, it's our opportunity to have Dr. Jeofrey Delacruz, and we can call him Tom today. Welcome, Tom, to Balance and Fall Support Group.
Hello.
Thank you so much.
Hello.
How are you today?
I'm
Tom?
doing well. I'm doing well. And yourself?
We're good. Thank you so much. Thank you for this opportunity. I know you're very busy. So, did I miss anything on our introduction? Tell us more about your lots of clients and your specialties. I told them you're Parkinson's, neurologic expert, and I also want to inform them that you are the founder and also the physical therapist clinic is Marian Physical Therapy based in Illinois.
Yes. Well, my background really is in orthopedic manual physical therapy. I completed my residencies in orthopedic manual therapy and scientific therapeutic exercises. They're all orthopedic based. The neurologic part, I just started adding that the last couple of years. Man Up, which is short for Martial Arts Against Neurologic Diseases, came to me because of one person, my mom. I get somewhat emotional. I get very emotional when I discuss this. For those of you who know me or have seen videos of me explaining my system, my mom suffered multiple strokes, and from there she developed Parkinsonism. If you follow the Parkinson's progression, she was when the time she passed away, stage 4. She couldn't really function anymore without other people. When she was still within the first 2-3 stages, I did all of my researches trying as a dutiful Filipino son to help mom out. So I did my researches. I did everything that I could. I researched. I looked at anything and everything that I could research. Brought it home to the Philippines. Unfortunately, when I got home, my mom was very sick, and she gave up. She developed severe depression. She would not do anything, which I understood as a part of the progression of the disease. I almost gave up. I was like, okay. I didn't know what to do until it just dawned on me. You know what? I was given this opportunity by God to do something. And so I thought that if I could not help my mom, I would help someone who wants to be helped, and I can make that into my mom's legacy. And so I just continued my research And I learned how to connect my background as a martial artist, as a physical therapist, as an orthopedic manual physical therapist to come up with Man Up. And so that's how it started. I am a big believer that he puts you in specific places at specific times, and that's how Man Up came up.
Yeah.
So,
That's really good. Sorry to hear that about mom. My dad too. Tom had also a multiple strokes. It's in our family, hypertension, and then we always had a stroke. Majority of my aunts and also my uncles, and always there's silver lining. So every time we sometimes it comes up, there's always a reason, and they are our why, right? So they
mhm.
are our why. So we focus on these things. People are saying, how come you ended up in these kinds of skills or a skill set? Because there's always somebody that the reason why we need to pursue those, because we need to help them. It comes up that it goes for them, things like that. That's why I'm
Yes.
also like in this some of them I met geriatric physical therapists, why you're doing home health, why you're doing this, and then his why is his grandmother who keep falling and then ended
Mhm.
up in the assisted living facility. So for you, your mom too. And I also heard about your mother-in-law
My
also
mother-in-law, yes.
with Parkinson's.
My mother-in-law developed Parkinson's.
Yeah,
She passed away last September.
I'm
So
sorry. Mm-hmm.
yeah, so it runs in the family. And if you read the research, they say that yeah, it's 10 to 15% can be passed on.
Mm-hmm.
So I don't know. In that case, my kids are doomed.
Yeah, yeah, that's the
So
reason why we're doing all these exercises, because exercise definitely decrease the progressions of the Parkinson's disease and everything, right?
yes,
Mm-hmm.
absolutely. There are a lot of researchers out there, and those same researchers I used in order again to come up with Man Up. So
Yes, that's really good. And so right now, what are the majority of your clients in Marian physical therapy? Is it more on neurologic, Parkinson's, or orthopedic?
I am an orthopedic manual physical therapist first. Like I said, the neurologic portion of my practice kind of fell into my lap.
Yes.
So most of my clients, most of my patients are orthopedics. I do have a
Okay.
background.
Mhm.
I do have a background in McKinsey, mechanical diagnosis and treatment of the spine, and that's what a lot of the doctors in the area know me as a spine physical therapist. But I'm trying to branch out. I'm trying to tell them that hey, I am more than a spine physical therapist. Give me
Mhm.
something, you know. I can do this. This is now my new program. I have Man Up. Give me your stroke patients. Let me
Yeah.
help you help them. I help give me Parkinson's patients. So pretty much anything and everything.
Yeah.
So I've been open for over 14 years. Will be 15 years in April. So yeah,
Wow.
I'm pretty lucky. I'm
Mhm.
pretty lucky. So
So wow, that's amazing. So you own one have one big clinic in Illinois. So you don't branch.
uh it's one clinic, yes.
Okay.
It's
Okay.
one clinic. Yep.
Wow,
It's in
40
Manteno,
years.
Illinois. Yes. Marian Physical Therapy. Been open since 2007.
Yes, congratulations.
But
So
thank
what
you.
are the skills on top of that? Let's say your favorite book that you want to share to us that influenced you, or different courses you had a Mackenzie. Other than
Yes.
that, what
Yes.
you learned that inspires you to pursue the orthopedic, or the things that you want to share for our clinicians listening you right now
Mhm.
that influence you in this field.
Well, my favorite book right now is the one by Dr. Ashclog. Uh, it's about Parkinson's, and it tells you anything and everything that you need to know about Parkinson's in the non-medical doctor way, if you could. He presents his book more as a guide for what do you call that? For the lay people, and so that's why that's what I like about it. Um, he uses easy words for people to follow, so that I can use now his words, and I don't have to explain a lot of things. I can use his words to explain to my patients now why this is happening, why that, and what to expect as the disease process progresses. I am also a big history buff, if you would. I like reading about history, Philippine history, World War II history, anything that happened in the Pacific arena. I like reading about them. So yeah.
All right. That's so your history. Very seldom I met a physical therapist who loves history. They're always like science, science, science. All right. Thank you so much for sharing with that, Dr. Tom. So can you show us more some of the moves about the manual man up martial arts in your logic?
Martial arts.
Yes.
Yes.
Yes. Mhm.
Yes. Well, martial arts against neurologic disease. I based it mainly on 3 martial arts. Kali, which is a Philippine martial arts, Taekwondo, which is a Korean martial arts, and Krav Maga. I am a practitioner of all 3 martial arts. Not to brag, but I do hold a black belt in Taekwondo. I do have I was this close to earning my first degree in Krav Maga. Unfortunately, COVID hit, and I was like, okay, better be safe than sorry. I also hold a rank of Yakan in Pikiti Tertiary. So, so my system was primarily based in Taekwondo before. And then as I learned more and more about the techniques of Kali, that's where I figured, hey, this resembles PNF very closely, proprioceptive neuromuscular facilitation. Yes. If you remember your D1, flexions, yep. There are movements, there are patterns in the Kali system.
Kali, okay.
Yeah, Kali or Eskrima. Kali, 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 or Eskrima, or Arnis, which is now the national sport of the Philippines.
Oh, I know Arnis.
So yeah, yep, Arnis, yep. And so there, the primary striking patterns of Kali. If you can follow my movements, that's proprioceptive neuromuscular facilitation.
Yes.
Yep. And so by following the pattern and now using what do you call this? The footwork. Okay, you can now also work on balance, proprioception. You can also work on coordination. There have been a lot of researches out there, especially the ones made by or done by the group of. I'm going to kill his last name. M.A.N. Anyway, and then let's see. Also by Shelley, her group, they made a research on how to improve your UPDRS, which is upper limb, United Parkinson's Disease Rating Scale. They figured out that doing repetitive circular movements, which is not using this. Basically what it is just making circular movements like this.
Okay.
Do it repetitively and it improved the UPDRS scores. As I was reading that, I was like, there are a lot of circular movements in Kali. So I was like, well, let me apply it. So I got my 2 sticks and I started doing this. And those of you who know Agnes will recognize this as Redonda. There's another practitioner, an Agnes practitioner based in UCLA. His name is McCarthy. I believe John McCarthy. He owns Cognitive Kali, and he figured out that doing the same thing, circular movements, now help with not only motor learning, but also with memory. And so he uses mainly this pattern in order to help with the memory. I still have to contact him and ask him the whys and the hows, but I found it very interesting. Our principles, our systems parallel each other, if you would. And so that's I guess that's one good thing about the system. I have been using this the Kali portion in order to help hand-eye coordination for vestibular patients.
Oh,
I
wow.
have my own. I shouldn't say have my own. I have adapted a system or an exercise using light, which I learned from my residency at Ola Grimsby. What it is you have a vestibular chart and you have a laser that's a laser pointer that's connected to your forehead. And what you do is you follow the pattern using only the laser. After that, I bring them outside and use the Kali. So again, I use mainly this particular movement. Again, going with the research that says the upper body coordination, the hand-eye coordination improves with repetitive repetitive movement. Going back to, again, I'm going to ruin his last name, M.A.N. He said that a single bout of high intensity exercise facilitates responses of motor learning. And so you can be as aggressive as you can with this. It would help your fine motor coordination. That is according to his group's research.
Wow.
So
Really good. Yeah, I really believe motor and coordination, it's really high. Do you add, Tom, some music with that? Because that's really good.
do I? Yes. And I ask my patients what kind of music they like because I want to improve their what do you call this? Their ability to follow, and for them to like coming back. Before I tried using ethnic Filipino symbol music, and how do I say this? They're kind of like cymbals or wooden xylophones. Then you hit them. They're very common music in Mindanao. I tried doing that, and a lot of them were bored. And so as I asked them, so what kind of music do you want? And believe it or not, most of them want 80s rock.
Yeah, okay.
And so
Like what? Like what? 80s rock. Like what?
80s rock. I still have to research why, but most of them like, and I guess it's because of their age, most of them like,
For me, every exercise, I just keep turning on. I want to dance with somebody.
Yeah,
Yeah, it's upbeat. Okay, what do you?
Van Halen.
Okay, yeah, it
Yeah,
depends on the tempo, right?
80s
Because
rack. Yeah, yeah.
yeah,
I think it's more the beat. You
yeah,
know,
it's
the
the
more
beat.
yeah,
Mm-hmm.
it's the beat. The more upbeat the music, the more they follow. They,
Yes.
yeah, you certainly, you know, if especially if you're not from the Philippines and all of a sudden you have this music,
Mm-hmm.
they're like, okay, what kind is that? What kind of music is that? And so their attention is more on the music rather than what you're supposed to be doing.
Mm-hmm.
So
Mm-hmm.
I changed that. I said, okay, tell me what you want. 80s rock, and so 80s
Yeah.
rock it is.
So
So that's what I play most of the time in my clinic when I do have the man up
yes.
patients. So
Yeah. Especially with Parkinson's disease clients, it's really effective, the music therapy and coordination.
music therapy,
Yeah.
yes, music therapy is very efficient. I guess it's the patient. I
Yes, yes.
Yeah, I've seen a video of a patient who had difficulty walking with a walker. He's a
Mm-hmm.
Parkinson's patient.
Mm-hmm.
He had difficulty walking with a walker. Uh, but as soon as they played the music
Yes.
that he liked, the music that he could follow, I guess
Mm-hmm.
the cadence of the music, yeah, he was able to walk. And I was
Yeah,
like,
very
cool.
easily.
And so there must be something in the 80s music that I play that they want. So
Yeah, that's good. So I believe your son was his name. Let's invite
JJ,
him,
this
Jay.
Jeff, this Jeffrey. Hold on.
Yeah, and then we can show some of the moves
Okay.
with our followers. Hi Jay, thank you so much for joining us.
So this is my son, Jeffrey. We call him JJ. Okay. We are going to show you just a snippet of what we do in Man Up. This movement again is inspired by the research of Shelley et al., wherein they were able to show, I guess, they were able to prove that fast-paced, repetitive, circular movements of the upper extremities improves the UPDRS score. So for those of you who know Kali, this is called Hubud Lubad. So, ready? Go. Go. So, it's circular. So, what we did was we just made circular movements going this way. What it is, it's blocking, parrying, and I don't know if you saw, I was
It's double hand.
shifting my weight side to side. When I teach this to my patients, I have them first just shift their weights forward and back, forward and back, and then as they slowly progress, I have them just shift their feet as we go through the movement. Do they all follow? No, this is rather high level coordination. And so if they don't, if they're not able to follow, then I just go with simple boxing movements. Western boxing, I guess because they've been exposed to Western style boxing, more than Kali. They can identify more with that. And so I have them do this. Ready? 1, 2, dip. 4, 5, 6. And so simple boxing techniques, simple boxing, what do you call this? Punches, simple boxing movements, for as long as they can follow it.
Yeah.
Again, my experience is my patients know this. They can follow this more than the other movements. But there are those that are very high level, high functioning. They're able to follow with the sticks. So, ready? 1. So, very simple movements. So, as you can see, we not only hit stick to stick, but we do trunk movements. Okay, so this would now help with dissociation and prevent dissociation of the trunk from your legs, and now will help break the I call it the log rolling, where they tend to walk this way. And then number 2, ready? So I now add some side to step. 3. As they become more and more comfortable with the sticks, I keep adding more and more complicated or complex movements. I have developed a series of flows and the progression of my exercises. Mechanical first, and then I do cognitive part, and then I do reflexive. And if they go beyond reflexive, that they don't need me. They need to see a professional Kali teacher. So,
that's really nice. That's really nice. I do the boxing too with my Parkinson's and other neurological clients. But I didn't do that. That's really good that you showed me, JJ, did the dip. How can I explain to them? What do you call that when they?
That's
what I'm missing. They do the punch.
It's a thing. Okay.
So what did I tell them? Down, like
down. Okay.
Down?
That movement we call I in my clinic call it dip. 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 Okay. It's a combination of 3 lateral movements. Okay. 3, 2 lateral movements, and so dip. So there you go. He slips. This is called slipping, and then he goes weaving, and then uppercut. So there's 2 lateral movements, and I came up with this because I have seen videos of professionals doing boxing with their patients. But what do? They just stand still, do this. Yes, yeah, you do upper body exercise, but what they don't add is footwork. I'm going to step back. Okay. I don't know if you can see this, but I'm going to put my.
Yeah. Okay.
Yep. So, okay, if you can see this.
Yeah, I can see.
Yep, you can see it.
Yes.
Give me the 2 other sticks. Oh, there you go. So.
Tinikling, huh?
Yeah, similar. If you go to my clinic, you'll see 2 bright tapes right smack in the middle of my my gym, and I use that for proprioception. Okay, so this is what I do. This is part of the footwork pattern that we use in Kali. Okay, So this is called the female V. This is called the male V. Together they make an X. So what I do is I just have them do this, which is easy enough. So I'm just going to take this out so I don't trip on it. So again, imagine you have a V, an X on the floor. So what you want to do is just do this, and then step back, and then forward, and then back. And then you can add more complex stepping patterns, again, as the patient's condition progresses. Now, the V or the X pattern that you see, they're probably too complex for the regular patient. Okay, so what I do is, and this is in my clinic, I have two lines parallel to each other. So instead of the V, which sometimes the V or the X, which sometimes they have a difficult time following, I just say, here, do this. Do step zigzag on the line. So this. You see it? So
Yeah.
yep. By doing this, you're just following the X pattern on the floor.
Yeah, that's really good, especially
yeah.
the direction.
Pretending you have two lines there. You can now face one way, so you do step forward, step back, step forward, step back. Now I'm going to change the. Okay. So there are three in Western style boxing. There's three types of movements to evade a punch. One is called the bob, which is this.
Bob?
Just bobbing up and down. So when you bob, what happens here? See? You have quads movement, you have glute movement, you have calf movement. Okay. Now, the other one is a slip. You just do this.
Okay. Just like
Yep. Just go this way. And then the other one is a weave, which is a bigger movement. You go from one, come down, and there.
Okay. So that's the weave. Yeah.
That's the weave. Again, bob, slip, and then the weave. So if JG comes here now, again, we're going to do the pattern, and you can use your own pattern. You can make up names for it. This is just something that I came up. Trial and error. This is something that I work with my patients, something that they're used to now. So, ready? Dip. One more dip. So you have two patterns now. You can do this. This is something a physical therapist can add to his boxing regimen.
Yes.
Yep. It doesn't have to be really big. You're not going to strike your patient anyway.
Yeah.
And then do this. Most patients know what we call pattern 3, which is jab, cross, hook. Jab, cross, hook. I'm going to lower this now. Okay. So I am going to use my trusty heavy bag. So going with what therapists or what patients, what do you call this? Their favorite jab, cross, hook. You can just add your X. And so when you're going forward, you step forward, jab, cross, hook. You don't have to do this. You can even have an open palm. Jab, cross, hook. Go the other way. So now jab, cross, hook. Jab, cross, hook. By adding your footwork, you are by adding your footwork, you're now adding another dimension: proprioception, balance, leg exercises. And so that's one good thing to add to your repertoire next time you hit the bag.
That's really good. I think we can also control the movement because they will just wait on your hand placement. So
Mm-hmm.
JK go dip or
Yep.
weave because you put your hands that way. So
Yep. I put my
yeah.
hands.
So
Yes.
so
Yep.
they will just wait because the reflex, let's say, is like this. So they're just going to control that, right? But when
Uh-huh.
you do that way, it means they need to do to
Yes, they need to
yeah,
duck. They
yeah.
need to duck, or else they're gonna get hit.
Yes, yes. And that's the goal only.
Yes.
So with your
Yep.
initial training, do you use those things first so it's easy for them? Yeah.
I use hand targets. Yes,
Okay,
I
okay.
use hand targets. I have different hand targets, and of course, we have to make sure that the patients are well protected, so they do have their own mitts.
Yeah. Do you know that sometimes instead of the arnis, like not the arnis, the wood, the one
Yeah.
that we're using, I use the noodles.
Oh
Like
yeah,
that.
yeah, yep.
Yeah, so it's softer and it's easy for them. So it's almost the
Can you
same
get
movement.
can you get
Yeah.
me two
Yeah, I
patties?
think I saw it at the back too. Tom, you have the noodles there at the back.
Yeah, I do have the noodles.
Yeah, so just for them to easily practice and then
Yep.
later on. Yeah, that's really good.
Yeah. These are I
Okay.
made these.
Okay,
These
so that's
are made from, I don't know if you can see it, but they're half-inch PVC pipes.
mm-hmm.
Yeah, and that I put insulation around them, and then finished off with electric tape.
Mm-hmm.
And so you can go to Amazon, you can go to any store and buy the already made sticks.
Okay.
Yeah, they cost about $15.
Is it two?
But for a pair, yes,
Okay.
yes. But I have a bunch of these. I believe I made maybe close to 20 of these for the same $15.
All right. And
Yeah,
then
for the same $15. Yep. So it's
wow.
all you need is your imagination and your creativity.
Yeah. And
So
I like also, Tom, your vestibular technique when you told me, because I just want to pinpoint all the techniques that you did with JJ. And you also specified the vestibular part with the laser. So
yeah,
you have it on your
yes.
eyes. And that's really a good technique.
It's focusing. It works on your focus. Yes,
Yes.
definitely.
Yeah.
Yes,
So
especially
what's the
those.
laser? So they wear it under, is
They
it like,
it's I have it on an elastic band here. I have it on an elastic band, and there goes the laser. And I do have in my clinic, I made up five
it's the normal light?
patterns.
Mm-hmm.
What?
It's the normal like small flashlights, right? That we can buy.
Oh, you can use that. Yes, you can
The
use
one that
that.
you put in the fingers like a toy.
Yeah, you can use that. Yep, you can use that. Put it around your forehead.
Yeah.
Yep, and
Okay.
then you can have them follow the patterns. I think I have 5 vestibular charts in my clinic that I made up. I can send you pictures of them if you
Yes,
would like.
please.
Yep. So
These are all really great new trainings, new techniques, especially for us clinicians, seasoned and also beginners, because we always want to incorporate new techniques to our clients. And boxing and music therapy, especially for Parkinson's, I like the dual and cognitive tasking. And you're also adding vestibular therapy, and also in neurological cases is really important for that. Yeah,
yes,
that's really good. And then when you keep telling the boxing, we incorporate, I agree with you. We keep doing, mine is like uppercut. I will tell them how many uppercut. Okay, 10. And then he keep doing that. So, and then I add only the mini squat. That's why I said when I like the trunk lateral rotation. So I will add the
yes,
weave. I will add the weave and the lateral later on. And then
Yes,
I said
yes, yep.
straight cut.
Yes, right, yep. Here's one thing that is important to consider. One, variety.
Mm-hmm.
Okay,
Yes.
but you don't you need variety. You need to move, but don't make it too complex. So
Yes.
what I do is to make it easy for my patients to follow is I number my striking patterns
Okay.
so that if I say one, Jay, so if I say one, that means okay, he strikes once. One, two,
Mm-hmm.
3, 4, 5, 6. Yep. So again, start with maybe 5 or 6 patterns. Go with it. So separate one. Again, one. Don't just stand there. Dip. 4, 3, 2. Dip. 5, 4, 1, 2, 4, 5. So by moving, you not only challenge the balance, you give him some kind of a proprioceptive challenge. Okay, and guess what? The patient also has to think. Here's the cognitive. Excuse me. This is the cognitive portion of it because you're making them think. Okay, what am I going to do with number 2? What am I going to do with number 3? Okay, when I do dip, is he going to hit me? No, I'm not. But that's it. Okay, now this is part of my progression. What I do is after I introduce the mechanical portion of it, where I show them, okay, 1, 2, 3. The second part would be now cognitive. I make him think. How do I make him think? I make him count during the movement.
Yes, yes.
So 4, 2, count to 3, 5, A, B, C to Z, go.
Yeah, that's the one I'm saying too. Letters.
Okay, make him think. Count, skipping one number, odd numbers. Okay.
Okay, that's
1, 3, 5, even numbers, 2, 4, 6. Spell your name. Where are you from? Spell your mom's name.
Yeah.
Spell the name of your girlfriend.
I spelled JJ, your girlfriend.
Spell the name of your girlfriend. His question would be, okay, which one of them?
So he's more confused now. Yeah, I also add Tom, so when we do that, okay, letter A, say any letter A, like animals begins with letter A, so they will keep thinking too, right? So
yeah, you can do that. You can
like
do
cognitive,
yeah, that's the cognitive portion.
Yeah.
Now the reflexive portion now would be where you don't say anything, but you just do something, and they would automatically react to it.
Okay.
So now, okay. So I'm not telling you how to move. I'm just showing you my stick. And so he knows that, okay, it's coming this way. So now he has to reflexively react to it.
Yes.
And that's just one technique that I use. But I tell them, do this, do that.
Yeah.
I do have another patient that's a martial artist, and so I just incorporate kicks with it too. So
that's really
that one is just mainly sticks.
Yeah, that's really good. So wherever is the reflex, or you said the stimuli is coming, which is the
Mm-hmm.
stick in our hand, that's where
Mm-hmm.
they're going to react and prevent. So that's,
Yes. Yeah.
yeah. Yeah.
That,
So
that's
tell us more about any courses, or how can we learn? Do you do those courses or educational techniques to teach other clinicians? Do you do that, Tom? Or how?
um I actually had I actually made a seminar.
Okay.
I did a seminar in 2018, November of 2018,
Yes.
and together with Mike Chua, and what's his name, Robert Rodriguez,
Yes.
we
Yes.
made a 3-day seminar. I did Man Up, Mike Chua did his Alzheimer's, and then Robert Rodriguez did his taping thing.
Yes. Can you, taping? Yeah.
Yes, yep, the taping thing. And so uh, the plan was to bring that somewhere else. I was wanting to bring that to another state. The two guys were on board with it. Then COVID hit, so I have been adding more and more things to my program. It's now come to the point where I have discovered some manual therapy techniques to help with muscle spasms and limitations of movement so that they can now move. Because, with Parkinson's, their world becomes smaller and smaller and smaller. You can use stretches. However, sometimes the muscle spasm makes it too difficult for them to move. And then when you stretch them, it's painful. By using manual therapy techniques, especially inhibitory techniques, you now soften up the muscles, you inhibit the muscle spasm, the guarding, the tightness. And so instead of just moving this way, they can now move better. Their posture becomes better and they can walk better. I have learned to incorporate several techniques. A big part of it is what we call PERT, or primal reflex release therapy by John Iams. Shout out to him. I do have permission to use his uh, uh, system, if
What
you
is that
would.
again?
PERT,
Oh,
primal reflex release treatment therapy
okay.
technique. PERT, PRRT, primal reflex release technique. It had a different name, and then he went with PERT. I went to his seminars. I was hoping to get credential to teach his program, but again, COVID hit. So he has five what do you call this? 5 portions, if you would. Part A, B, C, D, E, or 1, 2, 3, 4, 5. I completed
Okay.
4
Okay.
of the
Very
5.
good.
I completed
Yes.
4 of
Yes.
the 5. Number 5 is only being done in San Diego, which I was more than willing to fly to San Diego, but again, COVID hit, so I
COVID.
can't.
Yeah.
Yeah, COVID hit. I was going to bring Man Up elsewhere. In fact, I had a guy from Ulm, Germany, saw me, saw one of the videos that I made, and he asked me if I can go there.
Mm-hmm.
My brother is also a physical therapist in Hawaii. We were in the process of getting me to Hawaii to introduce Man Up. Again, COVID hit.
So lots of projects, but it's been put on hold for the
It's been,
meantime. Yeah.
it's been put on hold. I was going to bring this to the Philippines.
Wow.
I was in agreement. I was coordinating with a gentleman in the Philippines. I said, okay, I'm going to bring this there. I'm going to do it. Let's do it on this date, on that date. We'll do it in Manila, Baguio,
Yes.
Iloilo. Yes,
Oh.
unfortunately, my mom's condition took a turn for the worse.
Mm.
Instead of me using my money, the money that I was going to use to
What?
fly over there, mom's condition took turn for the worse. So I just gave them the money and I said, here, just use it. So,
Yeah.
but
Mhm. So yeah, there's still lots of time and opportunities. Yeah, we put it everything on hold.
I'm keeping
So
my fingers crossed that
yes,
this COVID would end so we can go back
I
to our normal lives.
That's
So
true. But definitely the skills are very important, and we can still do some of the Zoom via telehealth, because this can be done. See, we're just looking at those steps and skills. Definitely we can still learn from those, and we'll try to connect with especially our physical therapists back in Philippines. They're really looking forward for better, like, new skills. Even us here in America, we have many lots of cases of neurological cases. Definitely this will be really helpful, and not only neuro, geriatric, because
yes,
they are so
absolutely.
stiff, and they can really follow this very fast high amplitude exercises I use with the LSVT skills. I always incorporate, even they don't have Parkinson's, so every all the skills that you showed is definitely for everybody. Geriatric, orthopedic, but more on neuro because of the increased tone, the
Yes,
stiffness,
yes,
and everything. Yeah. So
yes.
definitely.
They can visit my clinic Facebook page at Marian Physical Therapy. I have numerous videos of me working with my patients there.
Okay. Mm-hmm.
Parkinson's. I had a stroke patient there. You'll see me work with vestibular patients, martial artists, one with
Mm-hmm.
shoulder surgery, all that. Everything's there,
Thank
and they
you.
can, yeah, they also through my Facebook page, Marian Physical Therapy, they can reach me if they have any questions.
Mm-hmm.
I will answer them as soon as I can.
Yeah. Yeah.
I'm willing to share what I know. Uh,
Definitely. Yeah.
yeah, I'm willing to share. For me, it's I'm doing this not for me, but I'm doing this for my mom's legacy, and so
Oh, that's really
um,
nice, Dr. Tom.
it's for her. So,
Amen. Yes, yes. That's really good. So she's really happy that because of her condition, you were inspired to do something, your skills,
yeah,
and you keep sharing everything. And lots of now clients having same condition as her. We always think that it is her that we're helping. Just like me, whenever I see a clients with stroke and old people, I always treat them as if that's my dad because I was not there when he was in Philippines and I'm here.
yes,
Treating different
yes,
people. Other people are there and I am here, but they are sick in Philippines and we're not able to do it physically with them. So
yeah, yeah,
is it
absolutely.
almost the same what happened to you? Because mine is my dad and my mom is back in Philippines. They're not here with me. So I am treating other people and I'm just telling him what to do. And then I'm just telling him just to do something, do a bike, and then he's a joker. And he will tell me, I will do that. Do you want me to die? And I'm just asking him to kick his leg and do the bike.
Yeah,
Just
yeah,
like
yep,
stuff.
yeah.
All right, thank you so much. How about email? So we have martial arts, physical therapy, Facebook, and also your page. Do you have any specific email that we can contact
Yeah.
you?
My work email is Delacruz at marianpt.net.
All right,
T
Marian.
Delacruz
Mm-hmm.
at marianpt.net.
All right. So guys, if you have any question, interested to learn more, we can hear more with Tom, and you can connect more on his Facebook in Marian Physical Therapy Facebook page. He has his email, and I will post this, Tom, once we share the video. and in YouTube, and also in the Balance and Fall support group. Definitely, we will put all your links and your social media page. That way they can see all the other videos. So thank you so much for sharing these skills. These
Mhm.
are wonderful. And thank you, JJ. You're so Thank you so much for your time. I how old are you? You
I'm
say
14.
14?
14. 14 will
Wow.
be 15. He's as old
Yeah.
as my clinic.
Okay.
He's as
Yeah, that's
old as
really
my clinic.
amazing. How
Yep.
old is he when he began doing the martial arts? 7? Like,
5.
wow. That's why
5.
his skills is
So yeah,
automatic. He's
I teach all my kids. We all went through the taekwondo stuff, and then I teach them the kali portion. So
yeah. Uh,
um,
Tom,
yes.
why do you think why we need to do like incorporate the martial arts, like the benefits of it? Like, so people, it's easy for us clinicians to explain to the client why I need to do this physically and a little bit of mentally, whatever. How do you explain that to them?
Well, I would. Okay, this is one of the things that I told them. You know, when before everything started, when people were like hunter gatherers, and when people were had to defend themselves.
Yes,
Okay,
yes.
this is what
That's
they
what we
did.
always say, right?
Yeah, this is what they did. You know, boxing using sticks. You know, the primal reflexes, the primal
Mhm.
urge to protect yourself. That's what I'm trying to use in order to get you better. And then I would say go back to the movies Karate Kid, wax on, wax off, wax on, wax off. Go back to Jackie Chan and the Karate Kid. You know, he was saying jacket off, jacket on. Um, put the jacket on the post or hang your coat up. All of that. And again, what are they? They're all martial arts techniques. Now, um, I tell them that when I start using the sticks, I say, okay, this is rewiring your brain now. The movements that you do when you do diagonal movements now, your right brain is trying to connect with the left side. The left side of the brain is trying to connect with the right. And so you have to keep doing the movements. And now I dance with them. I have a Mexican patient who loves to dance, and so I use a lot of the footwork with him, and then he would say, "Yeah, bailar, bailar, dance, dance." And so what he wants to do now, his goal now is to dance in his granddaughter's quinceañera. And I said, "Okay, let's do this. That'll be our goal for you to be able to dance in your granddaughter's quinceañera." So,
That's good. That's good. Yeah, I really agree because that's really good. Physically, mentally, and also behavioral, right? And then
mhm.
that's really good to incorporate this at young age. So this martial arts is not only for elder and older adults, but also for young age for them to be busy and physically fit. Yeah,
Yes,
yeah.
absolutely.
Thank you so
Absolutely.
much. Do you have any closing remarks for our listeners and everybody listening globally?
Yeah. Think outside the box. You know, when we were in school, they taught us only this, only that.
Mhm.
No, your imagination is the only thing that limits you. Your imagination. So if you just keep on thinking and associate things with whatever you learned in school, you know, learn something new. And I know some therapists don't believe in this having a big bag of tricks. You know, they said no, you only have one bag, use that bag. I don't particularly believe in that. Get a big bag, fill it with whatever you can fill it with. Reach down in there and use this for one patient. If it doesn't work, reach back in there, use this, use
Yes.
that. If you, what's that expression? If you limit yourself to one thing and one thing only, well, this is you. You have to be this, or you have to be bigger. So,
True. And our clients are not the same. How can you
no,
have only a specific skill? And
yeah,
then, so is it only that particular, you cannot treat a certain client that complaining of pain with orthopedic and then a stroke without any pain. So you really need to keep adding and adding different kind of skill because different
mhm,
clients, even they have all pain or all arthritis, all stroke, definitely they're still different. Other clients can follow and other clients has difficulty in
mhm.
perception. So always, and these are very important for us, keep improving yourself and invest in your skills. Learn always and apply. Definitely it's good for us as therapists and definitely for our clients, right? So this is
Yes,
another one way of learning. Your innovation of the month Tom, is really amazing. You have many skills that you put it on. You keep adding different skills and easy to remember. And you really adapt to the client's level because you
yes.
progress. The first one you showed is more advanced, and
Mhm.
then you're able to modify it with the level of understanding or skills of a certain client. So that's really good. And I think that's the things that we need to learn from you. So looking forward to learn from you, Tom. And thank you for sharing this all to us. Thank you so much,
Thank
JJ.
you.
You're welcome. So guys, it's another wonderful, thanks God it's Thursday, another innovator, another entrepreneur and physical therapist. So Dr. Jeofrey Delacruz, Tom is really amazing with his new skills. If you have any questions, connect with Marian Physical Therapy Facebook page and also in his clinic. So he's based in Illinois. If you have a family or relatives challenged with stroke, Parkinson's disease, or any other orthopedic concerns, connect with your doctors and get a script or connect with Dr. Tom, and he can definitely help you to improve and decrease risk of hospitalization or to improve your wellness, and decrease falls. Thank you so much, guys. It's me, Dr.
Thank you.
Jenny Yusuf. You're welcome, Dr. Tom. It's me. You can connect with Balance and Fall Support Group and Physiogen PT and Wellness. Bye for now. Take care. Thank you, Tom. Thank you, JJ.